Hi, my name is Kim Wallyman and I'm the lead for the Health and Wellbeing Promoting Schools team in the Vale of Glamorgan, working in the public health team at Cardiff and Vale University Health Board. We have a long-standing and valued partnership with SHRN and promote and support the use of the SHRN Pupil Survey and School Environment Questionnaires with Vale schools. There are many benefits for schools taking part in the SHRN survey. These include, but are not exhaustive to the following: identifying priorities and action planning, recognising and celebrating strengths and successes, supporting school transition through primary and high school, helping to inform decision making, following a whole school approach, including pupil voice group and school council involvement, evidence-based policy development, informing the curriculum, learner health and wellbeing improvement, wider support, resources and networking, and also an opportunity to be involved in cluster working on health and wellbeing themes. As part of the Health and Wellbeing Promoting Schools programme and team, we help our schools through the process of participating in SHRN. This includes signposting to the SHRN website, newsletters, webinars and updates, following schools' participation in the SHRN survey. We then also support schools to understand and use their school level data, bring together other relevant health and wellbeing information, and develop evidence-based informed action plans. We also help with monitoring and reviewing, and link schools with professionals who can provide support in specific health and wellbeing areas. To offer an example of how schools can benefit from SHRN, we can look at a recent project with Ysgol Gymraeg Dewi Sant Primary School, who we worked with following the last primary SHRN survey in 2024. Firstly, we linked in with the SHRN lead for the school to support with the initial analysis of the data. To ensure the learners were included in their own data analysis, a creative workshop was held for the school Health and Wellbeing Committee. This workshop was largely led by the learners themselves, made up of years 3 to 6. Within the workshop, learners were able to take time to look at their SHRN school level report and, using pictures, words and numbers, created posters with their ideas, highlighting main areas to celebrate as well as areas to prioritise for change. The group identified that sleep was an area of concern for their school. The learners used the quantitative SHRN data and discussed how they sometimes experience problems sleeping and going to bed at a certain time. Teachers within the group also expressed how sleep can impact learner concentration, mood and activity levels throughout the day. The Health and Wellbeing Committee then decided to create a poster with their ideas of how sleep can be supported, simple tips and ideas which they were keen to share with the whole school community. As a team, we supported these fantastic ideas by creating a bilingual infographic, which the school and Health and Wellbeing Committee could take ownership of and share with others to encourage sleep hygiene. The project became the catalyst for further work within the school, ensuring a whole school approach. The Health and Wellbeing Committee have presented the SHRN data and their ideas to the school governors and have supported a Health and Wellbeing Day with a focus on sleep. Plans are in place to have greater information about sleep embedded within the curriculum. This example demonstrates how SHRN data can act as a valuable starting point for meaningful learner-led data analysis and engagement, supporting schools to move from insight to action while placing pupil voice at the centre of wellbeing improvement. Recently, our team worked in collaboration with the Vale of Glamorgan Council, hosting 3 Vale cluster workshops for primary schools. It was an opportunity for schools already participating in SHRN to attend, but also those who had not yet started their SHRN journey. These workshops also welcomed the cluster secondaries to ensure the sharing of data across the schools and to encourage cluster working. Schools benefited from hearing examples about how schools have used their school level data, helping to inspire further work as well as making links to collaborate with other cluster schools on priorities. The workshops also posed an ideal opportunity for schools to look at transition data across both primary and secondary schools. This supports secondaries to see, for example, what their Year 6 learners are most worried about when going to secondary school, and for primaries to gain insight into Year 7 data. We have found that the cluster workshops have offered many opportunities. To further support primary schools who have taken part in SHRN, we worked in partnership with the Vale of Glamorgan Council to offer a small grant in which the schools could apply for to further action one of their identified school priorities from their SHRN data. We are looking forward to hearing how these grants have benefited Vale schools. The following quote is from Mark Davis, Operational Manager, Partnership and Community Working in the Vale of Glamorgan Council. This quote summarises the value of SHRN to both schools and the local authorities and national partners. Please take a moment to read this. Thank you for the opportunity to present to you today. I would encourage schools to reach out to your health and wellbeing promoting schools team in your area and find out more about how they support you and your school to make the most of being involved in SHRN. Jock and Val, thank you.